Good afternoon. Welcome to day 256 at the St. Clair County EMA office, where we bring you the latest information on the COVID fight. Joined here with Chairman Mark Kern from the County Board, and also Sam Bierman from the Health Department. And as we told you yesterday, we have a special guest joining us today, Chairman, if you would.
Great. So today we've got Patty Fisher here. Patty is the CEO of HSHS St. Elizabeth's Hospital. And Patty, welcome. We appreciate you being here today on our live feed.
Thank you very much. Can you hear me?
We can hear you loud and clear. So here we are today, and day 256, and we have more positives to announce today than we have ever had, I believe, in all of these days. So 292 positives today. Tell us, how are things, at your hospital, at your system? What are you seeing?
Well, thank you very much for having me on, and thank you to all of you for the good work that you do day in and day out. We certainly appreciate the transparency and the information that you provide us. Here at St. Elizabeth's, we're holding our own. We actually last week had hit a high mark where we had 50 COVID positive patients in the hospital. But it has come down a little bit, and we're more around the high 30s. So that is not good, but it was really worrisome when we got to that 50 mark, and we are happy to see that we've kind of stabilized a little bit. I think perhaps we've gotten past the Halloween parties and that effect, and now we're seeing just some concerning numbers, but nothing that has really put us over the edge. The thing, though, that's different with our system as well now is that we had tried to put together pods for COVID patients at our larger hospitals. So, we're based out of St. John's Hospital in Springfield. So it's our largest hospital. Then we have St. Elizabeth's as well. So we have some smaller facilities, and we moved all the COVID positive patients to the larger facilities. Well, now we don't have that luxury. So we have 9 hospitals in Illinois, and we have COVID positive patients at all of those. So even the smaller facilities in Breeze and Highland and Greenville, out in Effingham has 19 patients. So you really, see it change from in the spring where it was limited and we could kind of cohort those at the bigger facilities to having it widespread across all our facilities.
So a COVID patient takes a lot more care than a normal a person who's in the hospital for something else, something that's routine. How is the staff holding? I mean, you've got to have people that are tired working overtime. A lot of your medical professionals just have to be worn out.
They are, and they are struggling, and I think it's the same everywhere across the country. The nurses. It's not only the physical and the additional work that you have to do with your PPE and your respirators, but it's also the emotional toll. These poor people can't have visitors unless it's end of life. And so you have to be an emotional support for them as well. You have to make sure that you're communicating with the family. So there's much more of that goes on. But they are discouraged. I walked into the doctor's lounge yesterday, and 2 of the hospitals that we have, somewhat younger doctors, well, they're all younger these days, but anyway, they were discussing their patients, and both of them just said, I just can't believe it's lasted this long. I can't, I never would have thought it would have lasted this long. And I have patients who are what they call high flow oxygen. They can't get them off of these high oxygen concentration to be able to get them to go home. So we have these patients in here for a lot longer time than we would typically see patients. So it's discouraging there. We have a great team though, and we all try to work together. We have like quality colleagues who actually are helping out with transporting, and we even have managers, quality, senior team members who help clean rooms. We do whatever we can as a team to kind of pitch in so that nobody feels like they're in it alone.
Are you seeing that age ranges change with your COVID patients? I mean, initially, day 20, when we were having our first COVID patients checking into your hospital, I think they were largely an elderly population or an older population. Are you seeing that change, and does that change the way you deal with COVID patients?
We do see a slightly younger population now. So we just had someone in their 40s, got discharged yesterday, but she was in here for 2 weeks. And we do see a disproportionate amount of African Americans as well. And so that is something that has really kind of been a trend all along, which is unfortunate. But it's people, typically it's people when they're younger who have more comorbid conditions. So they have, diabetes, heart disease, high blood pressure. But every once in a while, you'll get somebody who's younger who has none of that and still gets really, really sick. So it's kind of across the board. But we do see younger people having it now.
So, Patty, what do you have a message that you would give? I think the fact that the numbers really don't seem to be slowing down. We're headed into a Thanksgiving weekend. If Halloween caused this kind of a problem, where we have a record day of 292 for a holiday that really doesn't necessarily have the gathering ability that Thanksgiving does. Do you have a message to tell people they gotta grab this and help out?
Well, I have an analogy that I thought I'd try out on you, if you'll let me, between mask wearing and smoking. Okay, so you ready?
Ready.
Yes? Okay. So, way back when, I think in the 60s, the Surgeon General came out and said smoking may be dangerous to your health. And I was a little girl then. And I recall when it came out, and there were disbelievers across the board. Nobody believed that. Now, very few people believed that. And, with a lot of research and time, we learned that, yes, smoking is detrimental. It causes cancer along with a host of other maladies. But then it kind of focused on, well, what about secondhand smoke? And there was some research that secondhand smoke was detrimental to the people around you. And I recall being a young nurse, and smoking was allowed anywhere in the hospital. We had ashtrays at the nurses' station. Okay, so as this research came out about secondhand smoke, we kind of put people and kind of congregated them in the nurses' lounge, which was really it's just this fog of smoke when you would open the door. But sooner or later, with research and time, we were able to go smoke free. But that took like 40, 50 years, a long time. So if you liken that to COVID, we're at 256 days. We've had a lot of evolving data and research and sometimes mixed messages. But I would say that we have come a long way in a short period of time in order to change some social norms and our habits. There was a survey done by National Geographic in July and asked people, how often do you wear masks? Always, sometimes, or never. 15% of the people surveyed said they never wore a mask in July. Same survey was done in October. Only 8% of the people said they never wore masks. So, I think that that's encouraging. And just like you wouldn't smoke inside around your kids because you want to protect them, you've got to think about wearing a mask in the same way. You wear a mask, it might protect you a little bit too, but it's really protecting the people around you. So you do it for the people around you. Unfortunately, we haven't done it enough, even though we've gotten a lot better. And we need to be really, really careful with the people who don't live in our house. And that's what's dangerous about Thanksgiving, because you're going to be around family and friends that you don't normally see. You won't be socially distanced. Many people won't be wearing masks, and it's a really potentially dangerous situation that will set us up for a surge that we might not be able to handle in the fashion that we want to be able to handle it. I come from a big Irish Catholic family. There's always hugging and kissing. I don't know if anybody knows the Toulons, but that's my uncle. So, this Thanksgiving is going to be a lot different. We're not having any large gatherings at all. And if anybody's got the sniffles, you should make them stay home. You should because I actually got tested a week ago Monday because I had some allergy symptoms. And when the nurse got done testing me, I said, I'm sure it's just a cold or allergies. And she looked at me and she said, I can't tell you how many people told me that, and they were positive for COVID. So thankfully, I was not positive, but you don't know. So you really need to take this seriously, and you really need to seriously consider your plans on Thanksgiving, because it could be a worst case scenario, especially for all of us in healthcare come December. So how was that? What do you think?
I think that was great. I think that sends the message. And when you had a sniffle, you didn't think you had COVID. We're very happy that you didn't, but if you had, and you never know, you could give COVID to someone and not really think you've got it, and there's no really, unless you are totally sequestered, there's no way that anyone can be sure that they aren't a carrier, an asymptomatic carrier of COVID. And so informing people that we got to keep these gatherings down is important, because if these numbers continue to spike, Patty, the systems are going to have, it's going to be an overload on the hospital system. Don't you think? I mean.
Oh, yeah, it has the potential to be. It really does. And that is, we don't, I know Mike said yesterday, it's not necessarily now the number of beds we have, it's the number of employees and competent nurses and doctors that we have to care for people. So every person that goes out limits our ability to really care for those patients. And it's not just COVID patients. We need to continue to care for people who are having heart attacks, who have an accident on the highway, strokes. I don't know, I might have told the story last time I was on, but people are hesitant to come to the emergency room, but that you shouldn't wait for things. We had a man in his 50s come with terrible abdominal pain, and he had perforated his bowel, and he died because he had waited so long and had small children. I mean, it was, it's really not just the COVID patients, but it's everybody else that we normally treat on a regular basis that we have to continue to care for. So it could be, it could be really scary. So I hope everybody is cautious and takes this as serious as they need to.
And I guess the good news is there is light at the end of the tunnel. We've heard about the vaccines, and they should be coming perhaps as early as the middle of December for specific people. And once they start rolling in, then then perhaps people will start to see the end of this. I think the problem is that in the past people have not been able to really see. Look, we're on day 256. We never would have thought that back in March that we'd be talking about this in November, but we are. But the good news is we won't be talking about this next November, God willing, and if everyone takes the vaccine and gets our immunity up and gets COVID out of our community. So I'm going to let you wrap up today and give us some additional words of wisdom, just in a concise way. Tell Team St. Clair what we need to do.
Well, I would totally agree about the vaccine, and I think that does give us hope. But what we need to do in the meantime is we need to do the basics. Wash your hands, watch your distance, and wear your mask. And you just really, really need to be careful around, not only in the grocery store or at work, but around your friends and family. You really need to think long and hard about social gatherings, even small social gatherings. And I think because of Thanksgiving coming up, that it's imperative that we be as cautious as we can be.
Well, Patty Fisher, thank you. We're lucky to have you in the community and as a part of Team St. Clair. Herb, what did I miss?
You didn't miss anything, and Patty, we appreciate, as always, being part of Team St. Clair, you and Mike. I know, as the chairman said, we don't want to overload that hospital system, and with the advice you just gave, hopefully some of those people out there who haven't been taking it serious will understand that from your analogy, what you gave us there made a lot of sense, and it will sink into them.
Well, thank you very much, Herb and Chairman and Sam. I really appreciate all the great work that you do, and reach out if you need anything or if anybody has any problems or issues. Thanks for having me.
Thank you. We appreciate having Patty Fisher on from St. Elizabeth's Hospital. Sam, we'll go into the numbers. They're up again. So.
They are. And before we start with the numbers, following Patty, and as the chairman said, with a record high today, I'd like to share something before we start with the numbers. This was from a doctor that has been working with COVID. He says, "We, the healthcare workers, are not the frontliners any longer. We are your last line of defense. You, my fellow people, are the frontliners now. The war has shifted to the community, and it is up to you. This cannot be won within the confines of the hospital." And I think it hits the nail right on the head when it says we need to do everything possible to prevent, people getting sick enough with COVID to where they get to the point of needing to be hospitalized and needing that high level of medical attention.
Very good.
So,
thank you for that.
Absolutely. And so we will go into the numbers. So as of today, we have tested 148,480 St. Clair County residents, which is an increase of 1,517. We are at 13,632 positives. As the chairman said, a record high today. This is the highest number of positives we've had in a single day, 292. And that does include both males and females from under the age of 1 up to their 90s. Today, our daily county positivity rate is 19.2%. And we are at 134,848 negative test results with no additional deaths to report today. And we are still remaining at 245. For those who have completed the required IDPH 10-day isolation period, we are at 11,182. For state totals, 9,990,304 have been tested, with 674,089 positive test results, which is an increase of 9,469. For deaths, the state is reporting 11,677, which is an increase of 125 from yesterday. For our hospitals that are in St. Clair County, currently we have 92 patients that are admitted due to COVID-related reasons, and 7 of them are on ventilators. Regionally, we have 245 patients that are admitted due to COVID-related reasons, and 22 of them are on ventilators. For our congregate living facilities that are currently or previously in outbreak status, these are cumulative numbers for those facilities, and we will only announce any facilities that have had changes. Brea of Belleville has 73 cases and 8 deaths, and that is an increase of 1 case for that facility. Cambridge House of Swansea is new to our list today. They have 2 cases and no deaths. Cedar Ridge of Lebanon has 103 cases and 16 deaths, and that is an increase of 10 cases for that facility. Integrity Healthcare of Belleville has 34 cases and no deaths, and that is an increase of 11 cases for that facility. Marca Nursing and Rehab has 29 cases and 2 deaths, and that is an increase of 1 case for that facility. And Sycamore Village in Swansea has 9 cases and no deaths, and that is an increase of 3 cases for that facility as well. We do still have some testing available this week. Tomorrow, Wednesday, November 25th at Southwestern Illinois College from 8 a.m. to 4 p.m. I have been hearing that the lines were very long today, so for anyone that's interested in getting tested tomorrow, make sure you get there early so you don't have to wait, but we are happy to hear that today had such a good turnout and we have people that are interested in getting tested. Now I will turn it over to Chairman Kern for his update.
Thank you, Sam. Nice job today. those high numbers. That is, I hate setting records like that. But I think it's important that everyone takes that to heart. 292 is just a huge number in St. Clair County. So we'll see where those numbers go in the zip code reports today. 62059 is up 1 to 24. 62201 up 8 to 361. 62203 up 5 to 372. 62205 up 12 to 359. 62206 up 14 to 673. 62207 up 4 to 363. 62208 up 15 to 788. 62220 up 11 to 971. 62221 up 17 to 1,263. 62223 up 15 to 856. 62225 stays the same today at 69. 62226 up 25 to 1,442. 62232 up 11 to 409. 62239 up 6 to 193. 62240 up 1 to 71. 62243 up 4 to 277. 62254 up 20 to 453. 62257 up 1 to 101. 62258 up 18 to 495. 62260 up 6 to 310. 62269, big number, up again 38 to 1,348. 62285 up 5 to 276. And 62289 up 1 to 21. And just, when I spoke earlier, I said, here's how those numbers are distributed. The zip code reports come from the state. That number of 292, we get that on a daily basis here in the county. So eventually those show up in the zip code report, but there's normally a 2 or 3 day lag or a 3-day lag getting those numbers in the zip codes. So I wanted to clarify that. 292 positives out of 1,517 tests lead us to our daily county positivity of 19.2%. Our 7-day rolling average is now at 13.1%. Both numbers way too high. The state has pegged our regional positivity today down at 14.2%. That's derived by Bond County today at 17.5%. Clinton at 20.5%, Madison 12.4%, Monroe 14.6%, Randolph 9.7%, St. Clair 18.1%, and Washington County is 24.5%. So we heard from Patty today, heard from St. Elizabeth's and Memorial Hospital yesterday. We got to make sure that this spread does not get impacted by Thanksgiving. We've got to make sure that people are sequestering as much as they can, staying with their family unit. Wearing these masks works, and we've got to encourage people to do that because if you think about it, 292 positives. Now those people were lucky; they know that they're positive, so they can isolate. But think of all the people out there that don't know they're positive. They're going to be talking about going to a celebration that could spread and spread that. And I know we have a video that we show that shows the possible spread. Let's contain it. Let's not have our numbers after Thanksgiving be like the numbers after Halloween.
Well, and it says, I'm watching some of the comments on here. One person says that they haven't seen their grandchildren since this started, and they're not going to be seeing them again. That is being proactive, and I appreciate those comments. There are still some that, they're saying, well, it can't be from a Halloween. You got to keep in mind, the Halloween is still a factor because it could have been at that week and a half after Halloween that we are still seeing the fallout from that. So that answers one of those questions there. But I want you to think about this also. 292 cases, the highest we've had. And a good percentage of them are going to be probably milder cases But when we talk about the hospitals that we heard from Mike and Patty, stop and think of all 292 of them ended up in the hospital, what that does to our system. It just blows the roof off of the hospitals. So I think that's why we have to be prepared. That's why we have to keep telling you we have to take this even more serious, because we don't know what those 292 that just came in today, what type of case they are going to be.
And Patty made the strong point that it isn't just COVID patients that they need to be treating. They've got to treat heart attacks and strokes and all of the
accidents,
everyday business. Why those hospitals really are there before COVID, those hospitals really have been functioning in the community and doing a lot to protect our health. Now they've got this additional burden of 292 positive cases in one day, 92 COVID-related patients just in the St. Clair County hospitals alone, 245 in the region. That is a big added burden on all these workers, and we've really got to keep all of them in our prayers, because they're out there fighting for us. And as Sam said, let's put ourselves on the front line. Let's protect them. Let's protect those numbers from coming in their hospitals.
Well, and that number that we keep watching, under the age of 40, 135 of them again today. So for all of you younger people that are thinking you're super person out there, it's there. You got to take it serious. And, talking of the first responders and those frontline workers, there's not a one of them, I guarantee you, the doctors, the nurses, as Patty said, the people who are cleaning those rooms after a COVID patient's been in it, there's not a one of them that was ever trained for this type of pandemic. And everybody who's going out there that isn't taking this serious, you're putting those individuals' lives at stake by being irresponsible. So, think about those EMTs, those paramedics, the doctors, the CNAs, all of those who are called upon that are working day and night. Some of them haven't had a day off forever and probably aren't going to be forever for at least until we get the vaccine. Every one of them deserves our respect, and we give them that respect and show them some compassion by this holiday coming up to stay away from those big family gatherings. Call them on the phone, do the Zoom, virtual meetings, whatever you want to do. Grab a chicken leg and hold it up and show them. But if not, we will be back here over the next 2 weeks from Thursday. And if we think these numbers are high, I guarantee you they'll be higher. So please, I know you're getting tired of hearing it. Team St. Clair, we're preaching to the choir. We follow those posts. We appreciate everybody sharing them. We're seeing more and more of the shares, people getting on there and they're sharing it. So there are people who are private messages and saying, at first we thought it was something else, but now we realize. So please continue to do that. We'll be back with Cindy and Daisy to translate this into our Spanish communities, and then we'll be back tomorrow for 257 days of this, and hopefully those numbers will be down, and everybody have a good evening.
Meet Jeff. Jeff is returning home to have Thanksgiving with his family. Unbeknownst to him or his family, Jeff is an asymptomatic carrier of COVID-19, meaning he has shown no signs that he has this deadly virus. Jeff spends most of his Thanksgiving day at home with his parents and sister, enjoying a Thanksgiving feast. After dinner, Jeff and his sister decide to go to their grandparents' house for dessert. Several other family members have come over to enjoy Grandma's famous pie. On Saturday, Jeff starts displaying symptoms of COVID-19, including a fever. He goes to get tested and finds out that he is positive and a carrier. Meanwhile, Jeff's grandfather starts also feeling ill. Eventually, he would have to be transported to the hospital because he's unable to breathe properly. Because of his close proximity to all of his family members 48 hours prior to the onset of symptoms, they must all now quarantine for 14 days. Jeff also now has to isolate himself for 10 days, and Grandpa remains in the hospital. We would like to remind you that COVID-19 is still infecting our community at an astronomical rate and taking lives each and every day. It's so very important to keep our gatherings small and only celebrate with those within our own family units. While these decisions can be difficult, if we work together, we can stop the spread of COVID-19. Wear your mask, wash your hands, and watch your distance.